Our mission for patient care, that certainly makes us special. Also, our people and their culture, that is very special. We are all dedicated to what we're doing.
So our mission at the University of Utah Health Sciences is to promote the health and well-being of the community here. When I first learned about the University of Utah, I associated ARUP with the University of Utah, and I knew that it was a real jewel here.
Our academic relationship means that our medical directors are faculty, and that creates this wonderful lab for them to launch new tests.
What's distinctive about ARUP is that ARUP is known for really the high-end specialty reference diagnostic tests. And so as a result, the academic community all over the country, the physicians who are experts in endocrinology to cancer, think of ARUP as the place to go to when they have a difficult diagnostic challenge or a patient that they need to manage who needs a complicated test done. They know that we have the expertise, and by association then, I think ARUP really enhances the reputation of the university.
The mission of the Department of Pathology and the mission of ARUP are in general striving to be the leaders in the field of laboratory medicine. We gain a lot from being in the university, but the university also gains a lot from having ARUP.
If you extend it further and think about sort of what in my heart makes me do what I do, I would say it's love of laboratory medicine.
I got into a job where I felt I made a difference, and I felt like I was doing good work every day, and what I did really mattered, and it does. And I get to see the results of that on a daily basis.
Every day I feel like I've made a difference in someone's life.
My favorite thing about the job is just helping people.
I am valued as an employee, and I'm a resource for other people throughout the whole company.
I get up every morning and I love what I do, and I feel lucky.
We're actually saving lives.
At the end of the day, my job satisfaction comes from that connection that I've always felt throughout my entire time at ARUP, knowing that what I do makes a difference.
You know, we're seeing dramatic changes in how healthcare is being delivered in the United States. The thing that has not changed and should never change is the fact that the patient is at the center of what we do. And I think that has been one of the most satisfying and gratifying aspects about being a part of the University of Utah, of ARUP, is that everyone here has had that philosophy that it's all about the patient.
Think of ARUP not as a lab, but as an extension of a hospital. 50,000 patients visiting this hospital every day. Now, they don't come here personally, but their specimens do. And we're providing information for their clinicians every single day.
I feel like we're that careful with every specimen. We want to do our best work so that we don't miss anything.
Might be one thing where you kind of get to know a patient, where you go up on the floors and you might draw them for a week straight, and you kind of build a little bit of a relationship, and I think you take a little more care with that specimen.
At these locations, the patient is right there waiting for his results, and it's up to the lab to get those results to them just as soon as possible in a very quality way.
My job gives me the opportunity, gives us the opportunity to do things for our clients that improve and support the patient care that they're trying to provide in their lab.
So each one of these samples kind of holds extra weight or an extra gravity with me personally, and I feel like I'm helping other families get the answers that they need.
I have a great group of coworkers. They're a lot of fun and really intelligent. They do their jobs very well. I couldn't imagine a greater group to work with.
I really love the way that they treat us here. It's a culture of they really show that you're important to them.
ARUP has a good, strong ability to support all staff members, including us in security, and I do truly love my job.
We're all a common team working towards a common goal, no matter what department you're working in.
I've got a very eclectic bunch that works well together. They're very focused and very motivated, and that helps me to be motivated and focused.
So whether it be the cleaning side or running the RPAC side, it takes a group to get that done. And that's probably my favorite part, is making sure that everybody's doing what they're supposed to be doing and that everybody's working as a team.
The whole ARUP community keeps the patient number one, because that is really what we do. I described what ARUP does, and one of the comments from the audience was that they just couldn't believe how small little Utah could have such a vibrant, important national reference lab. I just sat there and I felt a tremendous pride in what we do and who we are.